Do your legs feel tired, achy, heavy feeling, or crampy? These symptoms could signal a problem with your veins. Vein disease is a common condition in the U.S., affecting millions of men and women. Spider veins are a cosmetic problem, but can cause symptoms similar to the more serious varicose veins.
I was a SEAL Team 1 Echo Platoon, Vietnam combat veteran, and we were always very active and so forth. I got out, got into the construction industry, and then proceeded to drive 18-wheelers. And on the road, I would be sitting for long hours, and I noticed my legs throbbing.
The right doctor and the right treatment can make a huge difference in the outcome of your vein problems. Dr. Nisha Bunke and the highly trained team at La Jolla Vein Care offer minimally invasive treatments for vein problems to help your veins look better and to help you feel better.
We offer a variety of minimally invasive treatments to treat lower extremity varicose veins, venous insufficiency, and minor vein problems like spider veins. The first step in evaluating a patient is doing a detailed history and also a clinical examination. There are several things that we look for on physical exam, such as the presence of bulging varicose veins, where they're located on the legs, smaller vein problems, and then also signs of advanced venous insufficiency, such as skin changes like darkening of the skin around the ankles. What's always important in evaluating patients with vein problems is a duplex ultrasound examination. This allows us to see beneath the surface of the skin. Most people with varicose veins have an underlying vein condition that's not visible with the naked eye. So what these veins are is they're unhealthy, dysfunctional veins. The valves within these veins are no longer functioning. Typically you have one-way check valves within the veins. These veins are no longer functioning, so these veins are not moving blood effectively back to the heart, but instead just allowing it to pool. And the pooling of the blood causes the veins to bulge, and it also causes the symptoms.
Let's learn about minimally invasive treatments they provide.
For treatment of the underlying saphenous veins, we treat with endovenous ablation procedures. The endovenous ablation procedure we most commonly use is the radiofrequency ablation, or also known as the Venefit procedure. Instead of cutting out the vein like they did with traditional vein stripping surgery, we place a skinny wire into the vein, which then delivers radiofrequency energy. Radiofrequency energy converts to heat, and we're essentially cauterizing the vein from the inside to close it down. The other common procedures that we use are foam sclerotherapy, where we inject a medicine that's in a foam form into a vein. That'll cause the vein to collapse, it'll shrink, and it'll gradually dissolve over time.
La Jolla Vein Care took care of business. We eliminated the rope veins, all the spider veins. I'll be 67, in August, so I'm feeling great, feeling good now, and better about myself.
La Jolla Vein Care, helping your legs look better and feel better by combining genuine care with advanced technology.
Chelsea of Rejuva Health here, and I'm so excited. Today we have with us Dr. Bunke, physician and vein specialist of the La Jolla Vein Care Center, which is her practice. And she's going to share with us some of her knowledge and expertise as it relates to compression. Thanks so much for being here, Dr. Bunke.
Thanks, Kelsey. Thanks for having me.
So, some of the most common questions I hear are in relation to not only what compression is about, but who should be using it and how they should be using it. So, my first question for you is, in general, day to day, is there a certain group that could benefit most from something like compression?
Well, really everyone can benefit from compression. What we see on a daily basis are patients who have varicose veins, women who are pregnant, during their pregnancy develop varicose veins. So we use it in daily practice as a treatment for vein conditions and also for preventative measures for vein conditions as well. In general, anyone who has a standing occupation, sitting occupation, so for example, someone who sits at an office desk all day long, people in retail who stand on their feet all day, flight attendants, teachers. We have lots of we see this type of occupation quite frequently in our practice. And then also people could benefit from wearing compression to reduce the risk of blood clots. For example, on flights, we always recommend to wear compression stockings long-haul flights.
You mentioned that one of the biggest myths that you encounter is that compression is going to cut off your circulation by it being tight, especially behind your knee. Can you tell us a little bit about that? Is that the truth? What should we look out for?
Yeah, so medical grade compression improves circulation. It doesn't cut off circulation. So people often ask that. They say, you know, is compression going to cut off my circulation? They feel tight. They feel like they're cutting off my circulation. So it's important to make sure that what you're wearing is medical grade gradient compression. So with the gradient, what the gradient is, it gathers compression. It makes compression the tightest around the ankle, and it gradually eases as you move up. So because of that, it gets the blood flowing in the upright direction. So what people are concerned about is if they have compression socks that perhaps there's one gradient. There's not a different a gradient of compression. So certainly that can be counterproductive.
So based on this information, as long as this patient's purchasing a garment from one of the brands you've recommended that has this graduated compression, they have nothing to worry about, correct?
Right, graduated compression is beneficial.
So another question we hear often is, what's the difference between compression socks and stockings and TED hose that you might get in the hospital? Can you explain the differences between those to us?
Absolutely, so they're completely different. So TED hose, if you're not sure what they are those white stockings, stockings that they usually give you in the hospital if you're laying in the hospital bed, or sometimes you can find them in your local pharmacy. Those are completely different than compression stockings. So TED hose are good only for non-ambulatory patients, meaning patients or people who are bedbound. So what they do is they help prevent blood clots for people who are not moving. However, people who are moving and people who are standing upright, the effects of gravity are so much stronger than they are when you're lying down. So because of that, you need something with a lot more strength and a lot more compression to counteract the effects of gravity. So anyone who's walking, who's moving around in ambulatory, should not be wearing TED hose.
So oftentimes when people first hear my story, that I was 21 when I got a blood clot on a plane flight, they assume, oh, you're an anomaly. That's nice. Yes, that is different. I should pay attention for that reason, but I don't have to worry about that. It's not common. Do you see a lot of the anomalies like myself in your practice?
Absolutely, and I don't consider you an anomaly at all. We actually see, since we deal with vein conditions all day long, every day, we see quite frequently young women who develop blood clots, young women and men. There are many circumstances where you can develop blood clots, and in your case, it was flying. We do see several patients who have had blood clots from airplane flights or long car travel, or even in some cases just sitting at your computer desk for too long with not getting up and moving around. So we actually do see that. There's many other conditions that can cause blood clots. Pregnant women and being in the postpartum period, the hormonal changes can certainly increase your risk of blood clots. So for that reason, all pregnant women should wear compression stockings. So we see it in a variety of circumstances.
Do you have any tips along with compression stockings that our viewers could benefit from knowing? One thing I work on doing is drinking more water, getting up and walking around. Would you agree with that? And are there other things you would suggest too?
Absolutely. So you want to keep your legs healthy. You want to keep the blood moving. So you want to increase that circulation. So compression stockings do that externally by providing some external support. Moving around, walking, the calf muscles pumps your deep veins and gets the blood moving. Staying hydrated. If you're sitting for long periods or on flight, certainly stand up, take breaks, pump your calf muscles. Get moving around is certainly a big one.
For more on Dr. Bunke, vein health information, be sure to check out lahoyaveincare.com, and for all your compression needs, be sure to stop by rejuvehealth.com as well as compressrx.com. See you next time.
One of them is GAE, or geniculate artery embolization, and that's for knee arthritis. Everybody's familiar with knee arthritis. If you don't have it, you definitely have an uncle or a parent that has it. A lot of research studies are being conducted on it, and all the data show that it's one, highly effective, two, very safe, and pretty easy to perform in well-trained hands. So as interventional radiologists, we're very familiar with the vascular territory, which is the popliteal artery. We're in there treating peripheral vascular disease all the time. And this is targeting those blood vessels that actually supply the knee, and more specifically, the inflammatory cycle that is kind of driving the arthritis or the inflammation in knee arthritis. So that lining of the joint, the synovium, becomes hyperemic and hypervascular, and it creates a kind of circular inflammatory pathway. And so that's what we're targeting. We're shutting down that neovascularization that's driving the inflammation. And so when people undergo this procedure, it's an arterial access. We deliver tiny little microscopic beads into those knee arteries we localize it where their pain is, deliver those beads, reduce that hypervascularity that's associated with the inflammation. That kind of breaks that cycle. So it's really exciting because people are responding really, really well to it. And it's much less invasive than a total knee replacement.
Anyone living with arthritis, you know how painful it can be, and any relief is life-changing. So I am so excited to tell you about new technology unfolding locally.
And pretty easy to perform in well-trained hands. So as interventional radiologists, we're very familiar with the vascular territory, which is the popliteal artery. We're in there treating peripheral vascular disease all the time. And this is targeting those blood vessels that actually supply the knee, and more specifically, the inflammatory cycle that is kind of driving the arthritis or the inflammation in knee arthritis. So that lining of the joint, the synovium, becomes hyperemic and hypervascular, and it creates a kind of circular inflammatory pathway. And so that's what we're targeting. We're shutting down that neovascularization that's driving the inflammation. And so when people undergo this procedure, it's an arterial access. We deliver tiny little microscopic beads into those knee arteries we localize it where their pain is, deliver those beads, reduce that hypervascularity that's associated with the inflammation. That kind of breaks that cycle. So it's really exciting because people are responding really, really well to it. And it's much less invasive than a total knee replacement. Obviously, if you need a knee replacement, that's the gold standard. You still are going to need that. It's not going to change the structure of your knee. But if you're not ready for that knee replacement, or you're very high operative risk and they can't do that surgery for you, this could be a great option in reducing that pain and getting back some of that function.
And the procedures that you're offering, are these done with little to no sedation, or what's the downtime that comes with something like this?
Yeah, it varies by procedure, but we generally do procedures under moderate sedation or twilight sedation. So those are shorter acting, kind of quick on, quick onset, offset sedation medications, no breathing tubes, so you're usually rousable, similar to a colonoscopy, usually even less deep than that. Yeah.
Well, anybody who's getting through daily activities in pain knows how life-changing a procedure like this could be. So how can people get more information on everything that you have to offer?
Yeah, we have a great website at Jolla Vein Vascular, and you're encouraged to just call us. You can set up a consultation for more information. Yeah, it's really important. In some of the big studies they've done of this, reducing medications for knee pain, specifically opiates, reducing those or even getting off opiates. Hopefully you're not on opiates for knee arthritis, but some people with severe arthritis are, and we all know and are familiar with the dangers of that.
All right, well, Dr. DeYoung, thank you so much for your time, and how exciting for you to be on this cutting edge of all this technology.
Yeah, it's pretty great. Yeah, thank you so much.
All right, well, take care.
All right.
Today we're giving you 5 solutions to get a better body right now. Coming in at number 3 on our list are those dreaded varicose veins.
Such a common problem, and as we know, veins are those blood vessels in our body that we see here animation that return deoxygenated blood back to the heart, so-called venous return. And what is so important, the key with veins, is the function of these little valves inside those veins, because gravity wants to pull everything down. Without those valves, that's exactly what happens. So when the valves go bad, you get distended, twisted, painful, unsightly veins in the leg, and that's exactly what a varicose vein is, and we're going to show you how to fix it.
Well, varicose veins are not only unsightly, they can be very painful, like Dr. Worden just said. We now have a new laser treatment that is helping many women get rid of the problem once and for all.
I'm only 40 years old, and when I look down at my legs, I feel like I have the legs of someone who is twice my age. Several years ago, I realized that I had a varicose vein on the back of my left knee. They've continued to get worse and more bulging, very disfigured looking. I have some pain, like when you have a bruise, just tender to the touch. It's just sort of a constant thing that's always there. I'm always aware of it. To see this bulging, disfigured calf, it really has impacted my self-confidence. I used to think that my legs were one of my better features, and now I don't like to look at them. I don't like other people to look at them. I don't even remember the last time I put on a skirt. To find out that this could be treated with laser and just be able to get up and walk around immediately, I was thrilled.
The reason that Kimberly is such a great candidate for this procedure is because she has a very enlarged greater saphenous vein. Kimberly's vein is about 3 or 4 times normal size. The laser energy will be delivered directly to the inside wall of the vein, eventually producing a cord instead of a vein. And so the vein will no longer be able to have that backflow of blood causing the problems in her lower calf. All right, Kimberly, you're going to feel a little bit of pressure, okay? This light is the light from the fiber going up Kimberly's vein. It's a very concentrated form of energy. So I want it at 6.5. All right, start the pullback. The laser is destroying the inside lining of Kimberly's vein. Another minute or so, we're finished. And that's it. You can see the tiny entry point. So Kimberly's not going to have any scars, and I think she's going to have a great result.
I would love to be able to, throw on a skirt without always feeling like I've got to cover up my legs. And I'm just so looking forward to what the future holds.
Kim is here with vein specialist Dr. Margaret O'Byrne, and this is something that affected you at a fairly young age. Who at home needs to worry about this developing?
We all need to worry about varicose veins because we all stand upright. People that are walking around, that are sitting a lot, we're all potentially vulnerable to varicose vein problems. Men and women, both sexes.
But more common in women.
Certainly, women do seem to have a little more trouble with it, especially during the childbearing years because of the extra pressure of the pregnancy and the baby and the childbirth. And Kim was a great example of that, having had her third baby, and then sure enough, her veins were very, very painful. She developed blood clots in her veins. It was very important that Kim go ahead and get this procedure done.
And an important point for people at home is you don't need these veins to survive. So eliminating these veins, closing them off, is not going to cause any long-term problems, which is exactly what you're doing.
No, and that's a very good point. I'm glad you brought that up. There's sometimes a misconception, and some patients feel as though I need these veins. These are important to me. How can I possibly get rid of these veins? These veins are not helping anyone. Just as though this fiber was inside a vein, this fiber is going to be pulled back, and there's a certain amount of energy that is going to be generated inside this little plastic tube. And this is very similar to what actually happens inside a vein when this technology is being used in a real person.
So that's what was happening inside my vein as the laser went back through. It was just shutting down.
That's right. It's
the blood flow through that vein.
Specifically, it's destroying the inside lining of the vein, and it's also affecting the protein structure of the vein so that it collapses in on itself. And then over time, the body is really encouraged to resorb that vein entirely, and that's what will happen over the next several weeks.
So the vein just remains inside my body, but it just doesn't have anything flowing through it. Is that how it works?
That's exactly right.
I noticed when you came up here that you were wearing a skirt.
I am.
Yay.
For the first time in a long time.
So this procedure was done a little less than a month ago?
Yes, just about a month ago.
So I want to take a quick look at the way your legs look before the procedure again. Okay, so I want everyone to see this. And I want you to go ahead and show us your new legs.
This is the leg.
I don't see varicose veins, and I want to see them side by side because this is. Do you see any varicose veins?
No, that is.
This is the area where I had the varicose veins.
Very impressive result.
The procedure was virtually painless. I mean, it was. I'd liken it during the procedure to like a little bit more than when I pluck my eyebrows, and then a small amount of pain afterwards during the first 24 hours of recovery that I managed with ibuprofen, and it was easy. And I just am delighted with how fabulous my legs look.
Back in her skirts.
Thank you both so much, and congratulations on the outcome.
Thank you for staying with us. We want to take a second to talk about vein and vascular care. Varicose veins can leave people feeling self-conscious and in a lot of pain, but our Brandy Williams says there's a solution for the pesky problem.
Well, Ashley, pesky is actually an understatement because for some, varicose veins are super painful. Dr. Bunky is joining us. She is the medical director and vein specialist here at La Jolla Vein Care, and you are going to set the record straight. First of all, tell us what the difference is between spider veins and varicose veins.
Yeah, so that's a good question. People often ask that. Varicose veins are the large, bulging, twisted veins at the surface of the skin. Spider veins are also diseased like varicose veins, but they're much smaller. So they're very thin, thread-like veins, also at the surface of the skin.
And both are pretty common, right?
Right, both are common. 1 in 4 or 5 people have varicose veins. And like you mentioned earlier, they're painful for a lot of people. So the notion that they're cosmetic is often a misconception because for a lot of people, they can cause pain, heaviness, fatigue, swelling, they can form blood clots, and even the skin around the ankle over time can change and it can also break down.
I have women in my family who have varicose veins. They aren't pretty. Are they hereditary? Am I going to get them?
Yes, so there is a hereditary component. So yeah, so if both of your parents had varicose veins, there's a 90% chance that you can get them also. Yeah, and so if you have one parent who has varicose veins, it does increase your risk of having them also. But there are also other things like females tend to have vein problems 3 times more commonly than men, and other types of things. So pregnancy, standing occupations, if you're on your legs all day, you're more likely to develop vein problems.
And what's the best way to prevent them?
So that's a good question. So there are things that we think that we can do, lifestyle modifications that may delay their progression, but we're really not sure. So we do recommend active lifestyle, elevating your legs when you can, if you're sitting for long periods of time. And then if you have a standing occupation, then wearing compression stockings is very helpful.
Let's talk a little bit more about the treatment. How invasive is it? Is it painful?
Yeah, so vein treatments have come a long way. Over the past 20 years, newer treatments have been introduced. So most treatments are non-surgical for either varicose veins or spider veins. Most of the time, they're not painful. They can be tolerated really well. And they're all performed in the office, while you're awake.
And how many treatments do you have to have until we see results?
So the treatment plan is tailored to the individual.
Okay.
So, and it starts with the ultrasound exam. We want to know what's going on beneath the surface of the skin, what's not visible to the naked eye. Because a lot of times when you see some spider veins or varicose vein, it's kind of like the tip of the iceberg. There's something going on beneath the surface that we can't see, and it's all treatable. So that's the good thing. And the treatments are common and they're fairly easy for most patients. Spider veins can be treated easily either with sclerotherapy or with laser. The underlying vein conditions for larger varicose veins, those are a little bit more involved, but again, they can be treated with endovenous techniques like endovenous laser, endovenous radiofrequency, and also with foam injections. So we can inject a foam medication into the large bulging varicose veins that'll cause them to shrink and dissolve and gradually disappear.
And I know you guys have been here for 12 years, but you're making some changes. You're branching out.
Yeah, so really exciting news for us and our patients who often drive long distances to come see us. Now we can go see them. So we do have a location in Poway, Chula Vista, and Vista, and so it's really convenient for patients.
Yeah, you have all of San Diego County covered. Amazing. Well, this has been super informative. Thank you so much, Dr. Bunky. I appreciate your time today. If you guys want some more information on La Jolla Vein Care, just visit our website.
morning, I'm Roy Robertson. This is San Diego Made, San Diego Proud, where we present the innovative organizations which help improve the lives of people in America's finest city. Joining us today, two guests from La Jolla Vein Care Center, Dr. Nisha Bunky, who's a renowned venous disease specialist, and Jessica King, who's a vascular sonographer. I love that title. They're both dedicated to the treatment of vein disorders in their patients, which can be unsightly but also quite painful. And this morning, we'll discuss treatment options at La Jolla Vein Care which give patients relief. And Dr. Bunky, I'm saying, yeah, innovative. This has changed so radically, so completely over the course of the last couple of years. We'll talk about that in just a couple of seconds, but let's talk about the disorders that you do treat.
Yeah, so first I want to mention that vein disorders are common. They affect about 80 million Americans. So that means 1 in 4 or 5 of your viewers suffer from some form of vein disorder. So venous insufficiency is the most common, which is a leaky valve issue, which causes an abnormally enlarged veins that are twisted, dilated, bulging. Those are called varicose veins.
And we'll see these like in the exterior.
Yes.
We're going to put up some before and after pictures, and you'll see what it actually looks like before you do the treatment. What are some of the causes behind developing varicose veins?
Yeah, so most of the time it's genetic. Females get them more frequently than men. So there's hormone influences like pregnancy.
Okay.
And people have standing occupations or sitting occupations or more prone to having them.
Right. So that's an awful lot of people that are potentially impacted by this, a wide group. So Jessica, let's talk about how it is that you get into the diagnostic process when people come to La Jolla Vein Care Center. What's the first step that they go through?
Well, veins are deep underneath the surface of the skin, so not typically visible with the naked eye. We use diagnostic ultrasound to assess the veins, take a look at them, and see which veins are working, which ones aren't, the cause of the problem, and the severity. So I do a diagnostic exam, and then the patient will have a clinical exam with a practitioner.
And so some other clinics, they don't treat the underlying causes or get into what's happening below the surface of the skin. Is that right?
Yeah, unfortunately that's correct. So there's a big misconception with vein problems that it's just a cosmetic issue, which it's not. Most of the time, their presence indicate an underlying problem.
So let's talk about the treatment. What do we do now that's so different from years past? As I say, innovative, because years ago it used to be a really invasive procedure. What about now?
Yeah, so now is the best time to have your veins treated. The technology has really advanced. So in the past it used to be vein stripping surgery. Now we can still get rid of the veins, but we can do it all without surgery. And there's different procedures to do that. So we can do injections and inject a medicine into the vein to cause it to collapse and shrivel up and eventually dissolve. We can also use heat treatments like radio frequency energy or laser energy to heat the vein and dissolve it. So there's many different types of treatments.
That's incredible, and I would think that patients have to be really amazed by the evolution in the way that it can be treated, and some of them may have been, reluctant or thought, hey, I've tried other things, this won't work for me. But there is some relief at hand, right?
That's exactly it. So some people have had vein stripping surgery before, 20 years ago, and they're scared to have it again, or their parent had it, and so they're reluctant, and so they're usually very pleased to find out about the new procedures.
I'll bet. And you can schedule online through the website, right?
You can get all the information online and give us a call.
Okay, so that website is lajoyaveincare.com, and the phone number 858-550-0330. Dr. Nisha Bunky, she, by the way, did write the book on vein care, the Vein Book. Call 858-550-0330 to schedule your appointment.
You probably don't think about it, but being on the go takes a toll on your legs. Do your legs get tired and achy by the end of the day? Do your ankles swell? Do you stand or sit at your job for prolonged periods? Do you have spider veins or varicose veins? Over 25 million people in North America suffer from symptoms like these, and the likelihood of developing circulatory problems in your lower legs will increase with age, weight, pregnancy, heredity factors, and overall health. But there is effective relief for these symptoms. Wearing Sigvaris graduated compression socks and hosiery is a simple, fashionable, and comfortable way to be proactive about your leg health. Let's listen to what 3 people just like you have to say about discovering life for their legs.
I travel a lot for my job and I often work long hours. So many times at the end of a busy day or after a long flight, my feet would get tired and swollen, and it would really slow me down.
People traveling long distances will often experience swollen ankle and feet because they're limited in their movement and their venous blood flow is compromised. In some cases, long-distance travel may also increase the risk of more serious complications, such as deep vein thrombosis. So it's important that you stretch and take short walks so that you promote blood circulation. Wearing compression socks will also improve circulation and increase comfort during travel.
Starting to wear compression hosiery has made a huge difference. Now I decide my schedule, not my legs. My sheer fashion hosiery is really the perfect accessory. They look great, and they also provide relief all day long. There's no way I'd leave home without wearing them.
A typical workday for me is an 8-hour shift at the garage. I'm on my feet all day. I used to get home at night with this feeling of heaviness in my legs and in my feet. Every Friday night, my buddies like to go out, but many times I felt I just couldn't go.
What Rick is experiencing is common for people that stand on their feet for a long period of time, especially if it's on hard surfaces such as concrete. Veins are responsible for returning blood back to the heart and lungs, and they do so against gravity. Valves in the veins prevent blood from flowing backwards, but these valves can become stretched and damaged, resulting in pooling and increasing blood pressure in the legs. Over time, this may cause heaviness in the legs, swollen feet or ankles, varicose veins, and inflammation. Wearing graduated compression socks helps venous blood return and will relieve these symptoms.
One of my buddies, he tells me about these socks, Sigvaris. What do I know about socks? I get mine at the dollar store. So I try them on. These things are fantastic. I can't do without them. And this Friday night, I'm heading out with the boys.
As you can see, I'm expecting a baby. This will be my second. And this time around, I'm experiencing a lot more aching and swelling in my legs. I've noticed more spider veins, even the start of varicose veins. My mother told me she had varicose veins too, but that doesn't make it any more pleasant.
30% of women expecting their first baby will develop varicose veins. Having more than one pregnancy can increase that risk to 55%, and even more so if your mother had varicose vein when she was pregnant. Wearing compression stockings during your pregnancy is a proactive way of reducing discomfort in your lower legs and feet.
Starting to wear Sigvaris compression hosiery has been a huge help. Now I get instant relief from any discomfort throughout the day, and the added comfort of knowing I'm protecting myself from any future varicose veins.
Sigvaris graduated compression hosiery and socks for both men and women offer you effective relief from a range of common symptoms, including tired, aching legs and swollen feet and ankles. Whether you are on your feet all day at work, traveling, or in the office, and even at home, you will enjoy the benefits of wearing compression socks and hosiery. Graduated compression works by providing support and external pressure, highest at the ankle, and gradually decreasing up the leg. The benefit of compression is that it helps improve the flow of blood back to the heart. Sigvaris pioneered the concept of ready-to-wear compression stockings in the 1950s. Today, Sigvaris provides life for legs through a complete range of comfortable, effective, and durable products. The over-the-counter support therapy collection includes a wide range of comfortable and fashionable styles and colors designed to meet the active lifestyles of today's men and women. They are measured by shoe size and height and weight and are designed to provide controlled, graduated compression and a medical effect. Sigvaris, life for legs.
Serving all of San Diego, this is your Fox 5 News.
Okay, so this morning we're showing you how to get rid of those unsightly varicose veins so you can show off your sexy legs for the summer. And here to show us how is Dr. Margaret O'Byrne to talk about this procedure that we can get if we want to. Good morning to you. Thank you for being here.
Thank you for having me. I'm happy to be here.
Absolutely. We're going to start with a little fact versus fiction. Apparently, my producer loves to pop quiz me with these fun little things. So we're going to go over some true-false scenarios and break down the myths of varicose veins. Shall we start?
Love to.
Let's do it. Okay, so the first one is varicose veins are a cosmetic problem that do not cause serious medical issues.
Well, this is actually false.
Which is what I was going to say. Let's play the game like that. I like that better.
And I'm very glad that that was our first question, because varicose veins can actually be a very serious medical problem.
Yeah.
It affects 20% of the population, both men and women, and can cause serious disability, especially in the middle to the elderly years.
Okay, very good. So you need to get it treated. Let's get our next question up, which says standing on hard surfaces and crossing your legs will cause varicose veins, as we both sit with our legs crossed right now. And that one is
false.
False, exactly.
That is absolutely false. Oftentimes, many people will describe the fact that they have their varicose veins because they've been standing and they've noticed the veins are hurting them, especially when they're standing in the kitchen. Most of us actually do have hard flooring in our kitchen, and so we've made that association that it's really because of the hard flooring, and that's why we have the veins, and that's why the veins hurt. The fact is, it's the standing. It's not the floor surface that's actually giving you those symptoms of the varicose veins.
Good to know. Is it genetic at all? Is it passed down?
It's very strongly genetic.
Okay.
So many times patients will actually try and blame themselves. Oh, it's because I was standing, I worked in retail, I was a waitress, and honestly, they really should not berate themselves at all for that.
Right.
The issue is really who their parents were primarily.
Okay, cool. Next question, true, false. Treating varicose veins will cause more veins to come out.
This again is false.
I'm winning.
Common misconception. Many times patients are very concerned that they really should not get their varicose vein treated, because then sure enough, the next day, the next month, even the next year, a new large varicose vein will erupt, and that is absolutely not true.
Okay. Pregnancy causes varicose veins to come out. Is that true or false? I'm actually going to say true on that one.
Well, you're partially correct.
Okay.
So what
That's better than mostly wrong, right?
Yeah, that's true. So oftentimes we kind of think it's a cause and effect. In other words, because I'm pregnant, I have these veins. But actually what's really occurring is the veins have been promoted by the pregnancy, but the underlying genetic predisposition for the varicose veins is there. So, for example, I use lots of examples with my patients. In other words, you know, I have quite a few women in my practice that have never ever had a child. They have never been pregnant. They have very severe varicose veins.
Okay.
I have seen plenty of cases where someone has had 8 children and has the most minor of problems. So there's definitely not a correlation there, at least the way most people think about it.
Very good. Let's get to our last true-false question, which says over-the-counter supplements and creams can make varicose veins go away. Since you're going to show us a machine that aims to do that, I'm going to say that you're going to say that that's false.
Yes,
okay.
that is false. And this is a wonderful thing to talk about as well in terms of education. There are quite a few herbal supplements that are on the market. There's quite a few creams that are promoted on the market that will get rid of varicose veins.
Okay.
And it is true that there is a whole group of supplements called bioflavonoids that actually do help with the swelling and they help with the symptoms of varicose veins. But once a varicose vein has been established in your body, there really needs to be a direct treatment for that vein to, quote, get rid of it. So, you know, I think that, again, that's a misconception to think you can take a pill or you can rub a cream and the vein's going to go away. That's not going to happen.
Okay, we actually have an animation to look at, a video right now.
Wonderful.
We're going to look at. What are we seeing right here? What is this?
So this is an example, an animated example of how a varicose vein actually forms. And what we term as venous insufficiency is when the vein walls actually stretch and the valves, which are actually inside the vein, begin to dysfunction. So you can see that these valves actually are supposed to push the blood one way, and when we have
faulty valves or the vein wall has stretched, we end up having blood pooling or falling back the other way. This is an animation again of the procedure that we're going to review today called endovenous laser, using a cool touch laser, where the vein is actually destroyed with the laser, destroying the vein wall as well as those faulty valves and eliminating that pooling of blood.
Very good. Now you're going to actually show us how this machine works right now. You can do a little demo for us?
Yes, we are. We're very excited to do that. And what this is a cool touch laser. We like to use these laser technologies, and they are just so incredibly useful, especially in this situation for eliminating varicose vein disease. And what we're going to be watching today is the laser being threaded through a simulated vein, and we're actually going to be watching that live. And this is what happens inside the body as the laser is withdrawn through the vein.
There. And so, what's happening right now?
What's happening right now, if this was in somebody's body, is the laser is actually destroying this segment of vein, collapsing it as it goes. And this is actually what we did with our patient here, Tori, just a few days ago, treating her vein disease.
So if I want this procedure, I go in and I tell my doctor that I want the cool touch procedure. Is that what I tell them?
Right. The cool touch procedure, which is a type of endovenous laser that is on the market that I have used for quite a few years, and I've been just so happy with the results and so happy with the laser itself.
Gosh, it's so cool to look at, isn't it? Let's real quickly show the before picture of your patient, Tori. And this is her leg before. You can really see, especially the lower part of the leg there, the varicose veins. And now we're going to look at Tori. This is after how many procedures?
She had one procedure done, and she had it done 5 days ago, not very long ago at all.
Okay.
She walked into the procedure. The procedure was done under local anesthesia. It took about 30 minutes. We were just talking earlier how quick it was.
And Tori, I want to ask you, how was that for you? Did it hurt? Was it painful?
No,
Tell me about it.
It was very simple, and it was very minimal pain. It was nothing more than a prick, and it was great.
Have you tried other things before, other creams or ointments or procedures or things?
No, not at all. I acquired my varicose vein during my pregnancies. I have 3 children.
Okay,
and, They just didn't, I thought they might go away after I had the babies and stuff, and they didn't. So I then came to see Dr. O'Byrne and did the laser.
Well, your legs look great. They look fantastic. Thank you for showing them to us. Real quickly, I want to ask you, price-wise, what are we looking at here, and how many procedures usually?
Endovenous laser is done with one procedure.
Okay.
It's very, very unusual that you would need 2 endovenous lasers. And the price can range anywhere from $1,500 to $3,000 here in San Diego.
Does insurance ever cover that, or not usually?
It can cover that. There are
Okay.
certain qualifications that patients do have to meet, like in many medical issues. But oftentimes it can be reimbursed, and it can be directly covered by insurance.
Okay, so
it's
good
a
to
great
check
option.
out. Ladies, thank you so much for being here. We really appreciate it. And if you'd like to contact Dr. Margaret O'Byrne, you can visit our website, fox5sandiego.com. Just go there right now, click on that little scene on tab. Okay, Raul, back over to you.
Good morning, I'm Roy Robertson. This is San Diego Made, San Diego Proud, where we present the organizations in our community working to improve the lives of people in America's finest city. With me today is Dr. Nisha Bunky, who's the medical director at La Jolla Vein Care Center. She's a venous disease specialist who uses innovative new treatment techniques to help people with varicose and spider veins. We'll concentrate on spider veins today in a way that's totally different than it's been for previous generations of patients. We'll talk about these new techniques today, and it really is changing. Dr. Bunky, welcome back. Good to see you.
Thanks. Good to see you.
I remember last time you were here, we were talking about 80 million people being affected by varicose and spider veins. Give us the distinction between the two.
Yeah, correct. So they're very common. They're both common disorders. Varicose veins are the larger bulging veins beneath the surface of the skin. They're twisted, tortuous. The spider veins are much smaller. They're very small blood vessels just beneath the surface of the skin.
Okay, so we're seeing the spider veins here. So let's talk about this new therapy. Again, you were here just about a year ago. I don't remember remember you talking about cryosclerotherapy, and I certainly don't remember me trying to pronounce that. So tell us about this new procedure and what it does. We'll take a look at some video. You're going to see some needles here, but you know, it's important for you to take a look at this.
Correct. So last time we spoke about treatment of underlying vein problems.
Right.
Today we're going to speak about the surface treatment of these spider veins. So traditionally, sclerotherapy it's the gold standard for spider vein treatment. We use a small needle and inject a medicine into the vein that causes it to collapse and gradually fade away over time. Traditional sclerotherapy can be uncomfortable because of the needle sticks, but what we have that's new is cryosclerotherapy. So that combines traditional sclerotherapy, this treatment, with using a cryo machine that uses puffs a stream of cold air onto the skin that'll anesthetize it so that you actually won't feel the needle stick.
Okay.
So it's painless.
So it's just one step before the needle injection, just to make sure that it's kind of deadening the tissue. It's much less painful.
Yes, and at the same time as well. So we blow puffs of cold air while we're doing that procedure that you just saw.
Interesting. As I was saying, there's innovation that's going on in your field all the time. You've also developed this new cream that helps post-procedure. Let's talk about that.
Yeah, so we use Ricova cream after surgery to reduce any bruising, redness, or swelling that usually follows any medical procedures. Ricova is a post-surgery cream that we developed over the past 8 years to help our patients feel better and look better after surgery. After getting feedback from patients and doctors and based on our own clinical findings over the past 8 years, we've developed or created a powerful blend of natural ingredients that help patients recover after vein surgery.
Wow, that's great. And so it used to be that it was only administered by the doctor, but now it's commercially available. It's available through Amazon and through the website ricovacream.com too, right?
Correct, yes. So previously it was just available in doctors' offices, dermatologists, plastic surgeons find it useful after cosmetic procedures and surgeries, but now it's available to the general public.
So overall, we have to look at this evolution through the decades, and we're thinking, okay, this is not what Grandma was going through 40 years ago. This is completely innovative and totally changed.
Correct. Vein treatment is much more comfortable than ever before, and especially the recovery is much faster and more tolerable than ever before.
And what about the recurrence? I mean, do we see that the veins aren't coming back just in a second or two, or is this kind of a permanent solution?
Well, vein problems are lifelong, so we can treat the veins that you see being treated. Those are permanently gone, but you will develop new vein problems in the future. So it becomes a maintenance issue.
Find out more by calling La Jolla Vein Care at 858-550-0330 to schedule an appointment.
Nightly, but varicose veins can certainly be painful for some people. So what do you do if you're dealing with this condition? Help is here for you this morning. Dr. Nisha Bunky from the La Jolla Vein Care Clinic is here with us this morning. Thank you so much for coming in. We do appreciate it.
Thanks for having me.
Talk about varicose veins for a moment. I know my grandma dealt with this, and it used to break my heart watching her try to cover them up all of the time. There is hope and help for people out there dealing with what can be not only unsightly, but sometimes painful for people.
Right, so varicose veins are a common condition. They affect 1 in 4 or 5 Americans. And what they are, they're those bulging, lumpy veins that are not just unsightly, but they can be painful and they can also cause disability.
And so as far as varicose veins that are literally throbbing from the skin compared to the ones that are flat, is there a difference between the two?
There is. So varicose veins, they're basically what they are. Whenever you see varicose veins, they indicate an underlying problem called venous reflux or venous insufficiency. The smaller flat veins are typically spider veins. So they're a little bit smaller in size, but they're still veins that are not healthy.
Okay, so we're looking at some animation here of the difference between what was likely a normal vein, a healthy vein on the left, and then a diseased vein valve on the right. This can be caused because it's hereditary. What are some of the other causes of this?
Right, so genetics is the main risk factor for developing varicose veins. Most people have a family history of a parent or a grandparent like yourself who had varicose veins. If both parents had varicose veins, you have a 90% chance of developing them yourself. Other risk factors are increasing age. The older we get, the more likely we are to develop varicose veins. Although I have seen varicose veins in teenagers because there is such a strong genetic component. Women are 3 times more likely to develop varicose veins because hormones have a strong influence in the development of varicose veins. Pregnancy is a risk factor itself.
I know that happened to my sister, and she said, these better go away by the time this baby comes out. And they did for her, but sometimes they don't for other people.
So 50% of people with varicose veins during pregnancy, they'll resolve within 3 months after pregnancy. The other 50%, you're pretty much stuck with them. Other risk factors are obesity, leg trauma, immobility, and standing occupations. So people who have standing jobs like healthcare workers, teachers, flight attendants are at a higher risk of developing varicose veins.
So what can we do to solve the problem? I know that some people used to wear really thick, tight stockings on their legs in order to keep everything compressed. Is that still an option in order to prevent them?
Yeah, so we still recommend wearing compression socks, especially people who have standing or sitting jobs. The compression socks have evolved, so they're much more stylish, but still therapeutic now. Moving, it's a gravity problem, so if you're standing or sitting for too long of periods of time, you should get up from your desk and walk around, stretch your legs,
get the blood flowing.
Yeah, elevate your legs.
As far as some treatments that are available with you guys, I think a lot of people fear surgery when it comes to varicose veins. There are some up-and-coming treatments, some stuff that's already out there that's amazing and no surgery involved.
Yeah, fortunately, there are minimally invasive treatments now for treating most varicose vein conditions. So nobody really needs to have varicose vein stripping surgery anymore. So there's a variety of treatments depending on which veins are affected. There's radio frequency and laser treatments where we put a skinny wire into the vein, deliver either radio frequency or laser energy, and we heat the vein and close it down that way. There's also injections where we can inject a medicine into the vein and it'll cause it to shrink and eventually dissolve. So you can get rid of these veins without having any surgery, without the cutting.
And wear those summertime shorts again. We were seeing some of the pictures right there, and it's remarkable. I mean, going from what looks like to be quite a painful vein to nothing at all.
Yeah, and it's less traumatic, so you can get back to normal activities right away. Minimal pain. Most procedures are done in the office in less than an hour.
Fantastic. So. Dr. Bunke, thank you so much for sharing this information with our viewers this morning. LaJollaVeinCare.com is the website in case you need some more information. Again, that's LaJollaVeinCare.com. Keep up the good work. Thanks for coming in.
My pleasure.
More information, go to our website, san-diego6.com. Click on San Diego Living. All right, ladies, do you have your Valentine's Day outfit chosen yet? Maybe it's a skirt or a dress, or maybe you're thinking, you know what, I'm just going to wear pants. I don't want to show off my legs because of varicose veins. My next guest says she can help you. Dr. Nisha Bunke from La Jolla Vein Care is here this morning. Dr. Bunke, thank you so much for coming in. We do appreciate your help.
Good morning.
I think a lot of people associate treatment for varicose veins something that's very painful, requires an extensive surgery, and they're already dealing with varicose veins. They don't want to add on to the pain on top of that. Is there a big myth involving the treatment for veins?
Absolutely. Most people think that vein stripping surgery is the only way to get rid of veins, but the truth is vein stripping surgery is nearly obsolete. So there have been newer procedures that have arisen in the past 15 years that have really replaced vein stripping surgery.
Let's talk about 2 of those. These are both non-surgical, can be done right in your office. One requires local anesthesia, the other one requires absolutely nothing. Let's talk about the first one. It's radio frequency.
Right, so radiofrequency ablation or endovenous ablation is another name for it. So what we do for this procedure, this is a replacement for vein stripping surgery. So we use it to treat those larger veins like the great saphenous vein that used to be required to be cut out. So now we can just close it down by inserting a thin, flexible tube into the vein, and then we deliver radiofrequency energy. Radiofrequency energy converts to heat that'll cause the vein to shut and collapse and gradually dissolve.
Now we're looking at some animation right now. Does this one require the anesthesia?
So this requires a local anesthetic. So none of the newer procedures require you to be under general anesthesia. So this is done in the office. The procedure takes less than an hour, and we use a local anesthetic to surround the vein.
Fantastic. Then get right back to activities right after this is done.
Right.
When will they actually notice a big difference?
Yeah, so a lot of people notice that their legs feel better within a couple of weeks. Visibly, it can take several weeks for veins to start fading away. And it often requires another treatment called foam sclerotherapy for the more surface varicose veins.
So let's talk about that treatment. This one actually requires no anesthesia at all.
Right, so foam sclerotherapy is another replacement for for vein stripping surgery. And this is used to treat those big bulging veins at the surface of the skin. So what we can do with this is we can inject a medicine, it's a foamed medicine, into the veins that'll cause the veins to collapse, they'll shrink, and they'll gradually dissolve.
Are you amazed by how technology has changed the line of work that you're in?
Absolutely. It's completely revolutionized vein treatments. And so because of this, there's less trauma to the legs, there's no scars, there's no large surgical incisions, so people go back to work right away.
That's amazing. Now, you said you got into this first going through medical school and then realizing that there really is a need for doctors to specialize in this, because varicose veins can not only be unsightly, but they can be somewhat dangerous for people.
Right. So, yeah, my board certification is in venous and lymphatic medicine. So we specialize solely in treating leg vein disorders.
And so talk about for a moment what that can entail. I know some people say that there's a lot of pain associated with varicose veins. What other symptoms are they sometimes dealing with?
Right, so they can cause a lot of symptoms such as like aching, heaviness, fatigue. Varicose veins and venous insufficiency are one of the most common causes for leg swelling, which a lot of people deal with. They can also cause restless leg syndrome and night cramps.
We're looking at some before and after pictures here. Not only are the veins, especially those ones that are bulging out of the skin, gone, but there is not a trace that they were ever there in the first place. That is how remarkable these procedures are.
Right, yeah, and that's certainly the goal, is to eliminate these veins with as little downtime as possible, without much impact in your lifestyle, and without having any scars.
Talk about some of your patients who come in for these treatments. Are they amazed about how well these work?
Yeah, we usually hear, I don't know why I waited so long, I wish I would have done this before, but most of the time people have the misconception that vein stripping surgery is the only option to get rid of these veins.
All right, giving a lot of people hope here. I know some people that deal with this, and yeah, they wear pants and long skirts even when it's 100 degrees outside, and that's hard, especially here in Southern California. All right, Dr. Nisha Bunky, La Jolla Vein Care, where are you guys located in La Jolla?
We're located off of Genesee in the Scripps Zymen Medical Building, which is on the campus of Scripps Memorial Hospital in La Jolla.
Parking's really easy. You're great to find. The number's right there on your screen, as well as the website as well, LaJollaVeinCare.com. Mark came over here and lifted his leg and showed you something. How often do people do that and go, what should I do about this? That happen all the time to you?
All the time, every day, every day.
I thought Mark was being strange by doing that, but apparently, Mark, even at parties, people are like, can you check this out? What can I do about this? That just goes to show how common this problem is.
Extremely common, yes.
All right, Dr. Nisha Bunky, thank you so much for coming in. I'm sure Mark will be in to visit you guys very soon.
To go away. Historically, this used to be done through very invasive surgeries known as vein stripping. We no longer do that, and we're lucky here at La Jolla Vein and Vascular, where we have every modality available to offer minimally invasive treatment to get rid of the varicose veins. Immediately after treatment, patients are able to walk out of here. Oftentimes, they'll be wearing compression stockings up to several weeks. But after that, the goal is that they can live their lives comfortably and not have recurrent varicose veins or symptoms. So there are many things that can cause restless leg syndrome, but some of the factors are not always completely clear to us. So based on an ultrasound exam, if we see venous insufficiency, or what we call venous reflux, which is when the valves become leaky and don't seal well, so there's flow reversal back towards the feet instead of towards the heart, that can be a cause of restless leg syndrome that we can treat. So our typical patient is concerned from a cosmetic or medical standpoint. And basically it can be any concern based on they don't like how their legs feel or they don't like how their legs look. Most of my patients are women, however, I do treat a large number of men as well. Men tend to present at much later and more severe stages. We are so excited to have this brand new clinic in Vista. So La Jolla Vein and Vascular has been practicing in the La Jolla location for over 14 years now. We're excited to expand that quality care out to Vista. Over 10,000 patients have been treated at the La Jolla location. If you feel that you have a leg or a vein problem, you should definitely give us a call. We're happy to schedule you at the La Jolla or Vista location of La Jolla Vein and Vascular.
come back, the ancient
সেটা গেলে ভাই আমার হুম এইটা ঠিক আছে ভাই এনে কেস দিলে আর কি করার জেলে ভাত খাইতে হবে আর কি করার মনে করেন যে কোনো না কোনো আমার কোনো ঠেয়াবার পথ আছে না কোনো কিছু করার পথ আছে ঠেয়াবো কি দে কিছু থাকলিস না ঠেয়াবার কায়দা ওয়দা থাকে কিছুই তো নাই সেটা ঠিক আছে ভাই এখন এই যে আপনি তো জানেন আমার অবস্থা কেমন মনে করেন যে আপনি যদি কিছু করেন না ভাই আমার ঠেয়াবার সামর্থ্য নাই আর আমার ঠেয়াবার বল শক্তিও নাই আমার কিছু আছে যে আমি এদের ঠেয়াবো আমার ওইভাবে মনে করেন যে কেদার মতো হয়ে থাকতে হবে কেউ একটা নাথে দিলে ওইভাবেই থাকতে হবে আর ওর যে টাহা ভাই আপনি তো আমার পরিস্থিতি জানেন আমি কাজ না করলে আমার পেটে ভাত যায় না ওই টাহার যদি কেউ আমার যদি মাইরা ফেলায় ভাই আমার জানটাই না আমার ভাই টাহা টুহা আমি কিভাবে কি ব্যবস্থা করব এনে মনে করেন যে আমি তো খাইয়া বাসি না ভাই এছাড়া আমি কি করবো আমার কি কোনো পথ আছে কোন যে আপনি এই যে হুম 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 না না ভাই আমি তো না 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 ভাই না ভাই আমি না না ভাই আমি তো কোনো সময় কই নাই যে আপনি উপকার করেন নাই আপনি উপকার করছেন কারণ আমি এই যা কি কি করা পারি আপনার জন্য কর না আপনি আমার কোনো রাস্তা দেখাই দেন যে তুই ভাই এ কর হ্যাঁ হ্যাঁ না আমি কি করা পারি কন আমি কি চেষ্টা করব কন আমি ভাই আমার তো নিজেরই কোনো গ্যারান্টি নেই আপনার আমি বল ভরসা দিই কেমনে কন আমি না কাম করলে আমার পেটে ভাত যায় না হ্যাঁ সেইটা দিলি সে দেশে সে হে জানে বুঝাই দিবার কোনো কায়দা নাই ভাই বুঝাই দেবার কোনো কায়দা আছে কিছু আছে বুঝাই দেবার সে- সেইটা তো বুঝছি ভাই সেটা তো বুঝবা লাগছে না বুঝাও তো নিরুপায় আমারও তো কিছু করার নাই হম ভাই আর কি করা তাহলে ওই আপনি মামলা দেওয়ার চাইছেন যদি দেন তাহলে জেলে ভাত খাওয়া লাগবে আর কি করার এছাড়া আর কিছু করার নাই ভাই হুম। না ভাই আপনার শোনেন ভাই আপনার যেমন দেওয়ালে পিঠ থেকে গেছে আমার দেওয়ালে পিঠ ঠেয়ার কিছু নাই ও আগের থেকে ঠেয়ে রয়েছে কারণ মনে করেন যে একজনের কাছে যদি টাকা পয়সা না থাকে আপনি ভাই বিশ্বাস করেন না, সারা জীবন এই এই জীবন হ্যাঁ সে আমি জানি না ভাই আমি সে জানি না ভাই, আমার জানা মতে যোগাযোগ নাই, আমি কথা কই নিয়ে আসবো তোর সাথে। না বুঝা না বুঝ, আপনি আপনি আশেপাশের লোকের কাছে শোনাবেন ভাই, আপনার তো সত্যি কথা আমি কইলামই। কেউ যদি আমার অচেনা নাম্বার তো ফোন দেয় আমি ভয়তে যাই না, কারণ জানি যে ওর সাথে কথা কই আমি আবার কোন বিপদে পড়বো। আমি এমনি এই নানান সমস্যার ভিতরে বাপের দিনাত হয়ে গেছে, লাখখানি টাকা হেয়ে দেবো কেমন, আমি এই তো ভাইবে কুল পাই না। কাম না করলে পেটে ভাত যায় না। আমি ওর সাথে কথা কই কি আবার ঝামেলায় পড়বো নাকি? আমি ওর কোনো খোঁজ নেওয়ার চেষ্টাও করি না, আর কেউ অচেনা নাম্বার তো ফোন দিলে আমি ধরিও না। কি? আজ পর্যন্ত কি কেউ শুনছেন যে একজনের জমি আর একজন বেচা পারছে? কেন, কিসের জন্য আমার টাকা আমি বেচে দেবো? আমার টা বেচে দিয়ে আর একজনের তা দখলে নেবো আপনি? কেন আমার বাড়িতে আমি দেওয়ার যাবো কে আমার টুক? আমি থাকবো কোথায়? হুম। তা আপনি দখলে রাখেন না না আপনি, না ভাই, না ভাই আপনি সেটা, না 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 ভাই সেটা ঠিক আছে, আপনি দখলে রাখেন, আপনি টাকা দিচ্ছেন, আপনার তার আমি বাধা দিতেছি না যে ভাই আপনি দখলে রাখেন না বা আপনি যা আসেন না, আপনি দখলে রাখেন। না ভাই, না না এই না 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 ভাই এই জায়গা, না না কথাটা শুনেন ভাই, সেটা ঠিক আছে, আপনার আপনার দামে সমর্থন করবো লাগছে, সেটা ঠিক আছে ভাই। দেখেন একটা জিনিস বুঝেন, টাকা টাকা তো আপনি একা পাবেন না, আরো সবাই পাবে, তাই না? তো আপনার একারে তো আমি একারে তো আমি দায়িত্ব দিতে পারি না, তাই না? আর আমার কথা হলো কি, ওর জায়গার প্রতি, ওর ইসের প্রতি আমার কোনো দায় দাবি কিচ্ছু নাই। টাকা যারা পাবে ওনদের কি দেখি করবে না না করবে সেটা হলো তাকে ব্যাপার। আমি ওই যার কোনো দায়িত্বে নাই, কোনো ইসে নাই। আচ্ছা সে দিল্লি দেবেন, আমি কি করব? আমার তো কিছু করার নাই ভাই, আমার কইলাম তো আপনার যেমন দেওয়ালে পিঠ থেকে গেছে, আমার তো দেওয়ালে পিঠ ঠেকাই। আমি কি করব, কি করা পারি? আপ- না ভাই, থাকবে কেমন? আপনি দেন পরিস্থিতি আছে নাকি বলার মতো কিছু? না ভাই, কথা কথা থায় যদি কিছু থায়, কথায় আছে না যে জুলাই যদি, হ্যাঁ। হুম। না আমি কি করবো ভাই, আমার মনে করেন যে কেউ নাচে দিলে আমার ওই যাই পড়ে থাকা লাগবে। আমি ভাই কি করা পারবো? আমি কিছুই করা পারবো না। না ভাই, না সেটা যাই হোক, ওই যে আইনের লোক যদি সেটা বাড়িতে আমার ওই খাইতে হবে, কারণ কিছু করার নেই, আমি অসহায় ভাই। কারণ বাবা মা মনে করেন যে বাপ তো চলেই গেছে, রাইয়া যায় নাই কিছু, খাটতে খাটতে জীবন শেষ। তারপরে ভাই এটাই যে পলাই গেছে, একজনে ধরে কোথায় আছে হ্যান ত্যান, এই ঝামেলা ভাই, ঝামেলার ভিতর দিয়ে আমার এই জীবন যাওয়া লাগছে। এতে পাইছে তাতে মরে যাওয়া ভালো ভাই। ভাই আমি আম- আমি ভাই না ভাই, আমি কথা হলো কি, আমি ওর ভিতর জড়া বাড়িছি না, আপনাকে তো কইলাম অচেনা নাম্বার থেকে ফোন দিলে আমি ভয়তো ধরি না ভাই। কারণ ওই ধরায় আমি সারাদিন মনে করেন যে খাইতে ভাত পাই না ভাই। আমি ওই করবো না, আর ওই নিয়ে আমি দৌড়ি করবো। আমার মা আছে, একটা মা আছে, তার ওষুধ পাতি, তার 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 খাবার দাবার এইগুলো তো আমারই তো দেখা লাগবে, নাকি আছে কেউ যে আমার হে আইনে দেবে তারে দেখবে? হম। আচ্ছা ভাই, ভালো আছেন? আচ্ছা।
lasting treatment for unsightly spider veins. Dr. Nisha Bunky-Paquette is here from La Jolla Vein Care Center to talk about this problem. Good morning to you. Thanks for joining us this morning.
Good morning.
This is a pretty common problem. We talk about spider veins and varicose veins. How many people are affected by this?
Yeah, absolutely. So venous disease is a common condition. It affects 1 in 4 people. And varicose veins and spider veins are the most common type of vein disorder.
Okay, we're going to talk this morning about spiders specifically, correct?
Yes.
And is this indicative sometimes of an underlying condition, possibly?
It is.
It is.
It's often associated with the underlying condition. In the past, people considered it a cosmetic issue, but that's not the case. The majority of time, people with spider veins do have associated pain, burning, throbbing, leg fatigue, and even leg heaviness.
But the good news is those conditions and those symptoms can be dealt with pretty effectively nowadays, right?
Right. They're very treatable with minimal discomfort.
Okay, so at the La Jolla Vein Center, you have some different remedies for this. What are we going to be showing this morning?
Right. We're going to do a procedure called foam sclerotherapy. And sclerotherapy has been around for a long time. It's been around for over 50 years. But what's different now, the procedures have significantly improved so that there's very minimal discomfort and they're quite effective.
Okay, let's show the spot here if we want to get the camera up. Right on her leg. You've identified, of course, are those varicose or are those spider?
So this cluster here, this is a cluster of spider veins. But what I hope to show you with this light, this device uses infrared technology to visualize the connecting veins. So this cluster of spider veins actually has an underlying what we call feeder vein. So it's about a medium-sized vein, so it's not quite large enough to be a varicose vein. But as you can see, this cluster of spider veins is being fed by this larger feeder vein. And that's important to identify because you need to identify it and treat it in order to have effective and lasting results.
Okay, so these veins here can be treated with what you call the foam sclerotherapy?
Sclerotherapy,
Sclerotherapy, yes. Okay, so you're going to demonstrate that for us right now, right?
Yes, yes.
Okay, so what do? You actually just inject it, and this is all, of course, you don't need an anesthetic for this?
You don't need an anesthetic. The newer solution was actually used as a local anesthetic in the 1950s. So it's okay, a little
bit of a prick.
Little poke. And so we've already, so as you can see, this green light is clearing, so that indicates the solution is pushing the blood out of the vein.
And again, the green light indicates where those spider veins are.
Right.
And if they clear up, that means this is working.
Right.
Okay, now, are you feeling any pain? This is Wendy down here. Do you feel?
Yeah.
How does it feel?
It just feels like a bee sting, or maybe a little less than a bee sting.
Okay, maybe like kind of like giving blood or something like that. Nothing too serious.
Less than that, probably.
Okay, and you didn't receive any type of local anesthetic or anything for this?
No,
okay.
nothing.
Well, that's good news. Okay, and you can see it's very effective right away. This is an immediate effect, isn't it?
It is. It is. Initially, it does give the impression that the veins are completely gone, but it'll take actually about 3 weeks for the veins to completely disappear.
Do you do multiple sessions with this to have the optimal effect?
We do. Yeah. Most of the time, people need more than one treatment session to get best results.
Okay.
So.
But this looks quite remarkable. So right away, you're going to have a little bit of maybe some red. Do you have any type of immediate side effects from this? So maybe some bumping or maybe even bruising from this?
Yeah, that's exactly it. It kind of sometimes it feels like a little mosquito bite, and you actually get a little red welt that's similar to the welt that you get from a mosquito bite.
Okay, well, this is fascinating stuff. And so the foam is really the trick nowadays. Sclerotherapy has been around, as mentioned, for like 50 years. But the foam is, how old is this kind of new treatment? How long has that been kind of in operation in your office?
Yeah, in our office, we've used foam sclerotherapy for about 5 years, but it's been around for 20 years. More recently, has become popular in the United States.
Okay.
So it's actually because of foam sclerotherapy, you can use it on the large varicose veins as well. So it's actually replaced surgery in some cases.
So
the larger veins.
That will eventually just get rid of all the pain that could be associated with the spider veins and varicose veins as well?
Absolutely. If the pain is related to the varicose veins or spider veins, once these are gone, the pain is resolved as well.
Now, Wendy, did you have any discomfort prior to this procedure this morning?
Yes, if I stood for a long period of time, there'd be a lot of pressure and pain in my legs, and especially if I'd been standing all day. So.
What is the real initial cause of spider veins and varicose veins? Is it the standing for long periods of time? Is it the walking, the constant use of your legs? Is that what kind of does it?
Yeah, standing is a risk factor. So people who have standing occupations that require them to stand in one place for long periods of time, like hairdressers, flight attendants, teachers. But the strongest risk factor is heredity. If both of your parents had varicose veins, you have a 90% chance of developing varicose veins. Female, the hormones have a strong influence. Pregnancies, women who have had 3 or more pregnancies have a 50% chance of developing varicose veins. Age, the older we get, the more likely we are to have vein problems, and then also weight gain.
Okay, Dr. Nisha Bunky-Paquette, where can people go to see you and get this treatment, and then how much does it cost?
Yeah, so we're located at La Jolla Vein Care in the Scripps Zymed Medical Building at the Scripps Memorial Hospital campus. Treatment sessions are typically run about $500 per treatment session.
Okay, and you might need maybe 2 or 3 of those to have the optimal results.
Right. Wendy has a very mild case, so she's probably only going to need this treatment session. Some people have very extensive disease where they're going to need about 3 treatment sessions.
How do you feel, Wendy?
I feel great.
Good. And you can keep wearing those short shorts. That's a good thing,
right.
isn't it?
That's
With summertime approaching, too, and spring break and all that.
Yeah, I'm getting ready.
Okay, good for you. La Jolla Vein Care at Scripps at the main campus in La Jolla, right off of Genesee, correct?
Yes, that's correct.
Fantastic. A great procedure. So glad you came in to talk to us about it.
Great. Thanks
so much for your time.
¿Qué tal, amigos? Les saluda Nicole Shipshack de Telemundo 20 para Acceso Total. Hoy me acompaña Ana Martínez de La Jolla Vein Care. Bienvenida, Ana. Cuéntanos a qué se dedica esta clínica.
Gracias, Nicole. Bienvenida. Aquí en La Jolla Vein Care somos expertos en tratamientos vasculares. Tratamos las arañitas y las varices. Las arañitas son las venas moradas, azules, y las varices son las venas que resaltan de la pierna.
Ok, entonces, ¿cómo se determina el tratamiento que necesita recibir una persona con arañitas o varices?
Se hace un diagnóstico con un ultrasonido para ver cuál es el tratamiento indicado para el paciente. Después de eso, una consulta con la doctora Nisha Bunky.
¿Existe algún avance en la medicina para este tipo de tratamientos?
Sí, se hace la radiofrecuencia, que es un láser que puede quemar la vena desde adentro con calor, y escleroterapia, que es una espuma que mata las arañitas.
Ana, ¿es cierto que pueden ocasionar molestias más allá de lo estético?
Claro que sí. No solamente ocasionan que las piernas te duelan, te molesten, que se sientan fatigadas las piernas o que las piernas se hinchen, pero también puede ocasionar de que uno deje de hacer las actividades que uno hace diariamente.
¿Qué recomendación le puedes dar a las personas que creen tener alguno de estos síntomas?
Yo recomiendo de que no esperen. Aunque la vena y el problema se vea por muy chico, puede empeorar. ¿Y por qué esperar si tenemos aquí a los mejores doctores, los mejores tratamientos y podemos ayudarles?
Ana, ¿por qué escoger al equipo de La Jolla Vein Care?
En La Jolla Vein Care tenemos a los mejores doctores que están certificados por la Asociación Vascular, y tenemos a toda la tecnología avanzada para los tratamientos. Pero más importante, queremos que nuestros pacientes vuelvan a sus actividades normales, que usen la ropa que guardaron por años, que tengan ese tiempo con su familia y no parar por una simple variz.
La Jolla Vein Care me ha ayudado y me regresé a sentirme mucho mejor de mis piernas. Tenía años que yo no sentía lo que siento ahora, gracias a La Jolla Vein Care.
Muchísimas gracias, Ana. Amigos, ustedes ya lo escucharon. Problemas vasculares, la solución la tienen en La Jolla Vein Care, con tratamientos innovadores de última tecnología y en manos de expertos. Aquí en La Jolla Vein Care cuidan de tu imagen, pero lo más importante es que cuidan de tu salud.
Hi, I'm Roy Roberts, and welcome to San Diego Made, San Diego Proud, where today we introduce you to Dr. Sarah Lucas, who is a vascular surgeon at La Jolla Vein Care. A condition known as venous insufficiency and varicose veins are major causes of discomfort during pregnancy. So today, Dr. Lucas joins us to talk about venous disease and the best approaches for women to keep their legs healthy during pregnancy. Dr. Lucas, welcome. Good to have you here. So a lot of people probably unfamiliar with the term, maybe even pregnant women. Venous insufficiency. Explain that to us.
Sure. So venous insufficiency refers to pooling of blood in the legs, which can cause a variety of symptoms: leg swelling, fatigue, numbness, tingling, and varicose veins. The majority of pregnant women experience some degree of venous insufficiency, related to a multitude of factors: hormonal, increased circulating blood volume, and compression of the uterus on the pelvic veins. Our veins have one-way valves that are supposed to keep the blood going from our feet back towards our heart. But during pregnancy, those veins dilate, the valves can start to fail, blood pools in the legs, and varicose veins can form. About 1 in 3 pregnant women develops varicose veins, usually in the first trimester, and the earlier they form, the worse they tend to be.
So very common.
Yes.
Not unusual for women to experience this, but what can we do, what can you suggest for women to keep their legs healthy during their pregnancies?
Yes, and that's what the patients want to know. What can they do to avoid it or treat it?
Right.
Our approach to pregnant patients is pretty similar to our approach to the non-pregnant patient. We encourage women to stay active and to control their symptoms during pregnancy with compression stockings and elevating their legs whenever they can. It's very uncommon for a woman to require any type of surgery during pregnancy. We can usually manage them non-operatively. And the symptoms tend to get a lot better after the baby is born. However, there is a significant segment of patients who still have varicose veins and still have those venous insufficiency symptoms after the baby is born. And those women may want to return for treatment after they've completed breastfeeding.
Okay. Go on.
So I brought actually a few images of a patient who was treated.
Okay, let's take a look.
Who was treated at our clinic. She came in with really bad symptoms, severe varicose veins during pregnancy. We treated her non-operatively with compression stockings and leg elevation, and she came back after her baby was born. And as you can see in the 2 middle photos here, her legs were significantly better, but she was still having symptoms and she still had varicose veins. So on that final photo over towards the right is her final result after she underwent radiofrequency ablation and ultrasound-guided foam sclerotherapy. So the next question is whether wearing the compression stockings can actually avoid the formation of varicose veins. And unfortunately, we still don't know.
And we've got about a minute left here, so there is also the risk of blood clots, right?
Yes. So pulmonary embolism is the #1 cause of maternal mortality in the developed world. Usually a deep vein clot from the leg traveling to the lung. In pregnancy, there's an increased risk because the blood tends to clot and the blood has slower flow from the legs. So any woman who develops sudden swelling in their leg, shortness of breath, chest pain needs to seek medical attention immediately.
Okay, so we need to watch out for those warning signs, monitor it very carefully because it could turn into an extremely serious health situation.
Absolutely.
But of course, it's cosmetic first and well-being in pregnancy. That's what women need to focus on. What they need to do is to get in contact with La Jolla Vein Care with any questions. 858-550-0330.
After the consent has been signed, the leg is prepped in a sterile fashion. First, lidocaine is used to numb the skin. Next, the vein is accessed under ultrasound guidance. Once access is made, a tiny guide wire is inserted through the needle and into the vein. The guide wire placement is verified with the use of the ultrasound. After the guide wire placement is verified, a tiny incision is made. The incision is typically smaller than a grain of rice, and no stitches are needed. The access needle is then removed and the guide wire remains in place. An introducer sheath is then placed over the guide wire and inserted into the vein. The inner portion of the introducer sheath and the guide wire are then removed. The outer portion of the introducer sheath remains in the vein. The thin clary vein catheter is then inserted through the introducer sheath and into the vein. The catheter placement is then verified with the use of the ultrasound. Here you can see the clary vein catheter being inserted into the vein under ultrasound guidance. Proper placement of the catheter is verified with the use of the ultrasound prior to starting the clary vein procedure. After placement has been verified, the vein will now be treated. The end portion of the catheter is then attached to the clary vein handle. The medication used to treat the vein is then attached to the end of the catheter and secured in place on the clary vein handle. Under ultrasound guidance, the clary vein catheter is then turned on by a small trigger on the clary vein handle. Simultaneously, the sclerosing medication is injected into the vein, while the clary vein catheter is slowly being removed. The clary vein catheter will continue to rotate while sclerosing medication is injected down the course of the vein until the entire vein is treated. As you can see on this ultrasound image, the Clarivein tip is obliterating the vein wall, which will injure the vein wall, causing it to be irritated, while the medication is being injected and will ultimately cause the vein to close down. Once the entire vein is treated, the catheter is then removed. After the procedure is complete, the veins are then rechecked with the use of the ultrasound. Here is what the tiny incision looks like after the procedure. Stitches are not needed and a steri strip is placed over the incision. Gauze is placed over the steri strips and the stockings are applied. An additional ACE wrap is placed over the stocking and may be removed that night after the procedure. For more information about the Clarivein procedure, please visit our website at www.lajoyaveincare.com.